Good morning, everyone, and welcome to Monday Mornings with Margie. I know it's been a couple weeks, had a lot going on, and with COVID going on right now, it's not always easy to get people onto the podcast because people have a lot going on in their lives right now. But today we have a special guest, Dillon Hammond, and we're going to kind of reverse the roles a little bit here. And normally I'm the person asking the questions, but today I'm going to be answering the questions that Dillon is going to be sharing with me. And our focus today is around depression and what does depression mean, and for the average person who doesn't know a lot about depression, what might be some questions that people would have. So I'm going to let Dillon take over the questioning, and I'm going to do my best to answer concisely and in a way that people understand.
Well, thank you for having me on, Margie, and hello to everyone at home listening. I appreciate you having me on. I really wanted to do this because when I joined this company, I wouldn't consider myself a mental health expert, certainly not a depression expert, but I've learned so much from the company and you personally. I think you're a great teacher. So I wanted to take my experience and share it with other people because, as you said, I think it would be helpful because as we'll dive in, I think there are certain perceptions about mental health and depression specifically through maybe media channels and other avenues. So people who don't necessarily go into the profession or study it, they might have a different kind of outlook compared to what reality is. So I appreciate you letting me do this. And so my first question is going to start off kind of about that topic and getting started there. Thinking about some major celebrities in the past who have killed themselves or committed suicide or have come out with mental health stories, you would think as an average person, you think that how can they feel this depression? How can they feel any mental health obstacle when their money's taken care of, their housing's taken care of, all their needs are taken care of, and they have this extravagant life? And so I think certainly when I started, I considered depression just being like a deep sadness, and I figured it was a lot more situational. But now as I've grown and learned, it's not so much that case. You can be a celebrity, you can be a working parent with a great job and a wonderful partner and great kids, but there's just something that's nagging at you, and it's that depression, it's that mental health obstacle. So besides sadness, can you describe sort of what those feelings are for a person who's going through depression, who on the surface someone would say shouldn't necessarily be feeling those things?
Absolutely. So there's so many aspects of the questioning. So I think what I'll do is answer first the question just in general about depression and what depression looks like. And then I'd like to then move into your question about, when people look like they have it all, and maybe in some ways they do have it all, whatever people think that is, why do they still struggle? So the first thing about depression, I guess, like Depression 101, is that depression is a biological disorder, and also there are people who are more predisposed to depression, meaning if you have a family history of depression, just like if you have a family history of high blood pressure or diabetes, you will then be at higher risk to have depression. It doesn't mean you definitely will get it, but you will be at have a higher likelihood than someone who does not have a family history of depression. If you add on to that, if you start with the predisposition to depression and then you add life stressors to that, then you are sort of increasing the risk that you could have a depressive episode. There's some people that may not have a family history of depression, but still end up having a depressive episode. And that, also can be biologically based, but also situationally based, and life events, life stressors, um, hormones, lots of different things can contribute to having a depressive episode. So what is depression? I think every person's experience is a little different, but if you were to think about it, sadness is part of it. It's a persistent sadness, where you have difficulty finding joy in pretty much anything you do. Even if there are joyful things going around you and you should feel joyful, you can't. It's hard for you to feel that joy. Often people will cry more often or more easily. There's a sense of disinterest in things that might have excited them before. For instance, maybe you played the guitar and you loved playing the guitar and now you don't want to pick it up. You have no interest in picking up the guitar. Or, I don't know, maybe you were an athlete that was, exercising and going to the gym, and now you have zero desire or interest to go to the gym. So you have difficulty being interested in things you used to be. You have less energy. You have less motivation. And often for people who are depressed, they often feel sort of trapped in their own head. So often they have these depressive thoughts, and depressive thoughts are exactly what you think of. They're negative, unpleasant, unhappy thoughts. And very often people who are significantly depressed cannot get out of their head, even though they want to. So there's a trapped feeling to being depressed, that not only do you feel sad and you can't enjoy the things around you and you're not motivated to do things, but then you have these negative thoughts, and sometimes those thoughts are even distorted. They're so negative that they actually distort what's real and what's not real. So sort of the combination of all those things, and then you add in, often there's trouble with sleep. There's often issues with eating. Either people eat and sleep less or eat and sleep more. So that ends up affecting your whole schedule. And then lastly, there's people who experience thoughts or wishes to be dead, which is obviously the scariest part of depression. And, that adds a whole different layer to the person's experience and the family's experience or friends' experience around this particular person.
Mm-hmm. Mm-hmm.
Do you have any questions on that before I kind of jump into the other question?
No, I think you did a great job. And the one thing that I wanted to speak on was like the hopelessness and the lack of interest. I think for me, understanding depression, recognizing those symptoms has been kind of the easiest way to understand how it affects a lot of people. Because imagine you're doing the things you love, and you're making accomplishments and you're setting your goals and getting them, but when they happen, you just can't enjoy it. And it's that, what's going on in your head and the thoughts because of it. So I think that's a major indicator or symptom that I think is easy for people to, if you can understand that, then you'll understand depression as a whole. And you don't necessarily need to get in, but I think another thing is when we talk about depression, it's easy to just say depression as a general category, but from my experience in learning so much with Achieve, it's very rare that you just get someone who has depression. They often have maybe major depression or a specific type, and then they have anxiety or a PTSD because of it. So it seems like depression finds its way onto many other diseases comorbidly as well.
Absolutely. And that's a little bit about what I was going to talk about with your other part of your question. But yeah, I mean, I think that, you're absolutely correct. Often depression is just one piece of the picture. Mm-hmm. So there's often scenarios where people have previous trauma, People have debilitating anxiety, and sometimes their anxiety makes them depressed, and sometimes their depression makes them anxious. So it can go either way. Sometimes people have medical conditions. Sorry about the sirens in the back. Sometimes people have medical conditions that can cause them to feel depressed, or people who are in chronic pain. Think about if you're in chronic pain and you can't function in your life, that is enough to make somebody depressed. So the thing about depression or major depression is that it's often not just a singular diagnosis, and often there's many things kind of swirling around it. And like you said, comorbidities. The question you were asking about for people who sort of seem like they have it all, and end up, committing suicide, or maybe they eventually talk about their depression, it kind of goes with what I was explaining, but a little bit more. So I think that if you think about biology of depression, it doesn't matter if you're a CEO or you're somebody, a homeless person on the streets. If you are biologically predisposed to depression, you are biologically predisposed to depression. So I think that is at, the first step. The other thing is often, we don't know the full story for people. And so there's people, like I said, who have trauma histories that can really affect their entire adult life. There's people who have substance abuse, which is also frequently a comorbidity with anxiety and depression. So if you add substances into the mix, now you have somebody who's already feeling down, feeling depressed, maybe having some distorted thinking, and you add a chemical to that. For instance, alcohol is a depressant. So you add alcohol to it, and it's a depressant and it disinhibits you. So if you think about those areas, it helps you to kind of understand how these situations can evolve. The other thing is, you can have lots of things and be perceived as having everything together, but the way you feel on the inside may not equal what it feels like on the outside. And so it doesn't matter how many things you acquire or how many accomplishments you get. If the inside doesn't feel good, if you feel empty inside in some way, you feel a void that isn't filled by these things, all those things don't matter. And if you're a celebrity, you may also feel more like you can't speak the truth. You can't tell people everybody loves me and I'm the most miserable person in the world right now. It's a pretty vulnerable state for those kind of people to be in. So I think that those are some of the things that I would think about when you're looking at people who, look like they have it all going well for them, but yet they still struggle.
Mm-hmm. Mm-hmm. Okay, well, thank you. And so I think once again, you did a great job, explaining it all. And it's kind of tough to give, all that info and retain it all in a short podcast. So, one thing that's helped me is being able to interact with patients through Achieve and talk to people firsthand who have mental health obstacles. Mm-hmm. And so I don't think everyone necessarily has someone that they can talk to that might be a little bit more knowledgeable, where they might not feel comfortable. But say you were someone and you wanted to learn more, say you were talking to someone with a mental health, like say they had depression and you knew it for whatever reason, and you want to learn more about them. Yeah. Would you recommend asking them? Do you think, is that like an unanswerable question because everyone's different? There's, what are some good ways to learn more and talk to people that have depression to understand it better?
Yeah. Yeah. I mean, I think you're right. It's obviously situational, but assuming that you are concerned that someone's depressed, that you've seen changes in their behavior and in their mood that's concerning to you, and that you feel like you have a good enough relationship with that person that if you were to inquire about that, that that you wouldn't be totally overstepping something. I think that you can get two results of that. You can get one situation where, you know, you approach the person and they're grateful that you noticed and that you cared enough to identify it and speak it, sort of speak, like put it out there.
Mhm.
Um, the other part could be if the person doesn't want to deal with the fact that they are depressed, maybe because of stigma, say, right? Maybe they don't want to admit that what they're experiencing is depression. They may become defensive.
Mhm.
Um, is it worth it to ask and get the defensive side? I think so.
Okay.
If you care enough about the person, and you're coming from a loving, caring, supportive place, and you make that known to them that it's not a judgmental place, it's a place of concern. If they become defensive or don't want to talk to you for a while, um, I think it's better to put it out there than to not put it out there. And the other thing is, even if they're defensive initially, they've heard what you said.
Mhm.
So
Mhm.
they're going to think about it.
Mhm.
And also, they may come back to you. They know you're a safe person now. So if
Right.
they get to a point where, okay, I really need help, you might be the person they reach out to first because they know you're not going to judge them.
Absolutely.
So you've opened the door.
Thank you. Thank you.
Mhm.
And I'm going to add my own piece of advice and kind of answer my own question here.
Mhm.
Another thing, once again, just all from my experience, I think social media is a great tool to connect with people. And if you're comfortable, being that person that wants to talk to someone, just putting out a message that isn't directed to anyone, but, on a story, on a post saying, if anyone's having any problems, feel free to reach out to me. And I think that's a good way. Say you do have a good close friend that you're concerned about,
Mhm.
put that somewhere that they're going to see it, and
Mhm.
you make it very vague, and maybe that person will say, well, geez, I didn't realize I could turn to my buddy here and
Mhm.
ask them, and maybe they will reach out.
Mhm.
So those are some tips I've picked up myself.
Yeah, absolutely.
Yeah.
Absolutely. And I think for males it can be a harder situation because I think our culture allows women to be more emotional,
Hmm.
and to be more in touch with their emotions. And I think for males there's a different message that many young men and adult males and young and boys uh, get messages about feelings not being as acceptable. I think that's changing, but I think it's still relevant. And so I think that for guys to be able to reach out to some of their buddies so that they know they're kind of a safe person, is a really significant undertaking and really important.
Absolutely, absolutely. And so before we move on to kind of a new topic, I did want to ask one question. Once again, this could be an unanswerable question, and it might just be case by case kind of thing. But kind of just speaking from your experience and your treating patients in your past and currently, what do you think it comes down to more? It's kind of like the ultimate question: environment versus biology. So you had mentioned that certain people are predisposed. I can't even say the word, but you know what I'm saying.
Yeah.
Yeah, to certain indications. So
Mhm.
let's say person A is predisposed and there's a death in their family. They're going to experience grief and potentially depression. Are you saying that so let's say they did experience that depression. Do you think it's more because of the predisposition or because of maybe that event or something happening? And that's very specific because it doesn't necessarily, someone, it's very specific. But once
Yeah.
again, whatever insight you can give.
Yeah. So, couple things. I mean, grief is a little bit of its own topic,
Right, right.
because grief is not necessarily depression. When grief becomes depression is when it doesn't then it doesn't subside
Mhm.
over a long period of time, and you continue and you're not able to function,
Mhm.
then at some point grief can turn into depression. Um, but uh, if you were to take, let's say, a breakup, okay, so you're a person in your 20s, you have a predisposition to depression, and the person you've been with for 2 years ends the relationship. um, if you're predisposed to depression, there's a chance that whatever process you go through, because that's also a grief process to some degree, not probably the same as a death, but it
Mhm.
could be pretty close, I guess, to that. Uh, if you have a predisposition to depression, or if you've had previous depressive episodes,
Mhm.
then you are at higher risk to experience depression at that time. If you are someone who did not have any previous depressive episodes and did not have a family history of depression, um, that scenario may not lead you into a depression, but
Mhm.
it could as well. So I would say, the second person maybe has less chance. Um, but that's if like all things are even and there's
Right.
no other complexities that exist in both of those people's lives.
Okay. So would it be fair, maybe, if you knew that there was some depression in your family, or similar diagnoses, that maybe you should be a little bit more on the lookout for yourself and certain symptoms as
Absolutely.
okay. Well, that's great to know. That's great
Yeah.
to know. And so,
Mhm.
yeah, I think you've done a good job covering all that. It's all very nuanced, but there's some great tips that you can learn, and things that you can know in the back of your head to help yourself and others.
Absolutely.
Um, so the next thing I kind of wanted to talk about is, say you identified those problems for yourself. We'll talk about yourself for now, and you want to reach out for some help to somebody.
Sure.
Um, what do you recommend as a nice first line option? Primary care, or going right to your mental health provider? And then, kind of in this day and age, what are some great ways to connect with those types of providers,
Mhm.
and in different avenues you can explore?
Mhm. So, I mean, I think that for every person, it's different. If you have a primary care doctor that you feel comfortable with, and it feels like that's the one provider that you can talk to, then you absolutely could talk to your primary care provider, but you don't have to. You could, um, I mean, really the easiest way to look things up is on the internet, and you could Google mental health providers in your area, and also mental health groups or clinics as well. So there's options where you could see a private practitioner. Generally, they're in their own office, or maybe they share an office with a couple other people.
Mhm.
Or there's group practices where you might have, 10 to 12 therapists that are part of a group, or there are more clinic settings that generally have, a large number of therapists, several medication prescribers, some case managers, mentors. They have sort of a wider range of all different levels of care. So my suggestion would be either you speak with your primary care, or if you Google some people in the area and reach out to them. And sometimes you have to be persistent. Um, but generally speaking, you should get a call back, and someone should be able to schedule an initial evaluation with you, to determine what you need help with.
Okay, that all makes sense. And when you make that call, should you have maybe like your insurance information handy, or any other sort of information that you can give the person over the phone that they typically require on those first types of phone calls?
Yeah, I mean, usually people are going to want to know, your name, date of birth. Maybe they're going to ask your address and phone number, and then they're going to want to know what your insurance plan is, because number one, if it's a private practitioner, they may or may not take it. And if it's a clinic, then they're going to want to know which therapist to assign you to complete the intake, because not all therapists take all insurances.
Okay.
If you go online, often there are, something like Psychology Today, where if you click on the provider, it gives you a background on the provider, what their specialties are, what insurances they take. I tend to think if you're looking for a private practitioner, that Psychology Today is a good option, because it does, often there's pictures of the therapist as well. So it just gives you a vibe on the person before you put a call into them.
Yeah, absolutely. And I know you've talked about this with former guests on your podcast, but it is a vibe. You've got to feel out that person, because you're going to connect with them, and you've got to be able to build that personal connection. So
Absolutely.
yeah, getting to know them first. And so that brings us to a fun little exercise I wanted to do, where
Okay.
I kind of wanted to get a feel of, if I were going into my first appointment with you as my LICSW,
Okay.
maybe you knew, like, I called and I'm having maybe some issues with depression and anxiety.
Okay.
In that first appointment, and obviously, once again, it's always different for every person, of course, but maybe what are some general questions, or some sort of things that you try to understand about the person, to help them going forward for that first appointment?
Mhm. So usually my style would be to let the person know that I would be completing the intake assessment, and that this did not mean that I needed to be the therapist per se, that we could see how the initial meeting goes, and we could decide if we were a good fit for each other. Because some therapists have more specialties in certain areas than others. And sometimes on the patient's end, they don't connect with you. So I always put out to people that they had the option, if they didn't feel like they had a good fit with me, that I didn't have to be the person, but I at least could get the process started.
Mhm.
Usually what we start with in those kind of evaluations is you're talking about what's the presenting problem. So you're generally starting off with what brought you, what made you pick up the phone and call to come in here.
Okay.
And then maybe the person will say, I've been feeling so sad, I couldn't take it anymore.
Yeah, I'm gonna pretend for you here. So what
Okay.
brought you
So I
today?
would say, Dillon, what brought you in here today to meet with me?
All right. Well, thanks for having me, Margie. What brought me today is, I've been really stressed at work. We've been, opening some new offices, and it's a lot of responsibility on my plate. And I've been losing sleep. I think about it. Whenever I have a free moment, it's the only thing I think about, is making sure we get everything right. And it's just, like I said, I just feel off lately.
Mhm. Okay. And how long would you say lately has been? How long have you been experiencing these kind of symptoms?
Oh, geez, good question. Maybe about a month.
Okay. And have you ever experienced anything like this in the past?
Not on this level. I know certainly, deadlines and assignments have gotten me, anxious and such like that before, but nothing on this level that I can think of.
Okay. So you're saying your sleep's off. So
Yeah.
when you say your sleep's off, you're saying you're sleeping more or you can't sleep? And how many hours are you getting a night?
So I'm getting a lot less sleep. It's harder for me to fall asleep. Even when I put the phone down, I find myself taking an hour or so to fall asleep, and then I'm waking up multiple times. So if I'm lucky, maybe 5 or 6 hours, but it's also broken up. So, and
Okay.
when I wake up, it's usually because of it, like a dream. Like I said, it's always something related to work. It feels like.
And when you were sleeping normal, what would be a normal average night's sleep for you? How many hours would you sleep?
Oh, geez. Sometimes 10. Falling asleep on the couch at 8 o'clock, and got to drag myself up at 9, 10. So yeah, at least 8, I'd say.
So this is a distinct difference in your sleeping pattern before and your sleeping pattern now, and you see it lining up from the period of time that you've been feeling increasingly anxious and feeling some sad and stressed, the sleep correlates with that over the last month.
Yeah, I think so. I think so.
Okay. Okay. Have you noticed any change in your appetite?
Nope. Never been much of a big eater, but no changes in appetite that I
Okay.
can think of. Yeah.
Okay. And what about, have you noticed either changes in your mood, like becoming tearful or crying, or maybe getting agitated over things that maybe you wouldn't normally get agitated over?
Yeah, agitated, I think I've noticed a little bit. Decorating season. So the person I live with wants to decorate for Christmas a little early, and you know, I don't. And so I've had, because I'm the tool person, I've got to hang everything up and having a difficult time with some things. And I noticed that the other day I was trying to hang something and I wasn't working, and I completely just lost it. I threw the stuff and I had to walk out, and I don't think I've ever done anything like that before that I can think of.
Okay. All right. Um, and after you have those kind of episodes, or you are feeling stressed, do you feel bad? Do you feel guilty after? Do you feel shame around it, or do you just not think about it after it happens?
I felt a little bad, of course, but really, still in my mind, like we don't need to put up the decorations yet, so I'm
Mhm.
not too mad actually. I'm more mad that I had to do it. So,
Mhm.
and it's not done yet. So,
Mhm. Yeah. Okay. Um, so what I would want to know more about is your motivation. Is it better or worse than normal? Your concentration better or worse than normal?
motivation feels about the same. Concentration in my personal life a little less there. Difficult to concentrate on certain things, but my motivation feels there. I do want to keep going. I want things to work out at work and everything, and still in my personal life.
Mhm. And what about interest level? Things that you used to be interested in before, do you still have interest in those things?
Not so much big video game guy, and I just find myself, when I have the time for it, I'd rather just lay on the couch and stay on my phone and not really move. Uh,
Mhm.
so a
Mhm.
little lack of interest, yeah.
Okay. And finally, any thoughts ever of wanting to harm yourself?
No, no,
No. So that never comes in, moments where you may wish that you weren't here?
no,
No.
no,
Okay. Any thoughts ever about wanting to hurt anybody else?
no,
No. Okay. Um, any ever hearing things or seeing things that don't appear to be there in reality?
no.
No. Okay. Okay. Um,
So are
do
those?
you want me to? Yeah,
Oh,
it's like I could keep going, but
yeah.
I think that, yeah. So
I,
that would be kind of, that's really just like the initial, and I'm sure I missed some of the questions I would ask, but that's really getting kind of, we want to know like what the picture is. What I probably would ask more about would be stressors. Are
Mhm.
there things going on? Was there something that happened a month ago that maybe sort of pushed you over the edge? And then really the rest of the evaluation is going to be um, asking about family history,
Mhm.
asking about substance abuse history for yourself,
Yep.
asking about any trauma history, medical issues.
Mhm. Mhm.
Um, I would say psychosocial stressors, like what's sort of going well, what are the good things in your life, what are the stressful things in your life, who do you have in your life that's important, um, your social history, what your educational background is, where did you grow up, that kind of stuff. So
Mhm.
it's really helping, if you think about it, to paint a picture of both why the person's here and a draft of who this person is as
Mhm.
a whole walking in the door. And then the final goal is to look at diagnostically what you're thinking the diagnosis would be, and then what's the treatment plan? Like, what are the goals going to be for this person if this person chooses to enter into treatment?
Mhm. Mhm. Okay. Well, thank you. I appreciate the exercise. And for
You did
those,
a great job.
well, thank you. Thank you. I was going to say, for those listening, I'm not stressed at work. We are opening offices, but it's a breeze because we offer a great treatment and it's nice and easy. And the people in the communities are awesome. And at home, we have put up the Christmas decorations early. I don't mind at all. There was like this like a key hook thing I put next to my door though. And there's like, if you take it off, there's way too many holes in the wall now. And that was very frustrating.
Yeah.
So
Yeah.
a little, what drew
Well,
from
the
reality
thing,
on that.
the thing is, for someone who was feeling depressed, you were smiling. So I don't think people probably think you're depressed.
Yeah, yeah, yeah.
But anyways,
I did want to ask one question though. Based on those questions, I understand. I think I understand, and I hope people at home understand like kind of how and why you ask them and get to the reasoning and such. But what if I would just sat there and I was just kind of like, oh, I don't know. Like when you ask, like, oh, have you been like a little bit more like angry or certain or bursting out more? Like, what if I was just like, oh, I'm not sure. What if I gave you a bunch of kind of nondescript answers?
yeah, I mean, then I would have to ask more detailed questions.
Hmm.
Um, and I think that if at some point I wasn't getting anywhere in the conversation, I wasn't getting some of the details I needed, I would maybe say that to the person, like, in order for me to understand what's going on, I need to ask you these questions. And I know it's hard to share. I think the other thing that's important that we would go over in the first session is also confidentiality and
Hmm.
people understanding that what they share in the therapy stays in the therapy. The only time it doesn't is if there's a safety risk, an imminent safety risk,
Right.
either the person to themselves or the person to somebody else.
Mhm.
So that's also important for people to know that what they share, this is a safe place to unload whatever it is they need to unload.
Okay. Okay.
So,
Yeah, I think that all makes sense. And I think that comes down to what we talked about earlier, making sure you pick the right person and
mhm,
hopefully, people learning from this experience or learning out there, knowing that when you are going into those sessions, like it's going to take a little bit of opening up and being vulnerable.
mhm,
So you gotta be willing to do that. And the person on the other side is hopefully just as willing to take that in and
mhm,
help you out whatever way they can. So
absolutely.
I think you nailed it. I think you answered all the questions I have, and I think all the questions someone who maybe doesn't understand depression or mental health that much would want to ask. So I
Absolutely.
appreciate you having me on and letting me poke your brain a little bit today.
No, it was fun. It was fun to be the person answering the questions this time.
Yeah.
So I hope it's helpful to people listening. And if not for yourself, for maybe somebody that you know. And if it's not a situation where you need to help yourself, maybe you can be that person who extends a hand to someone else who might need the help or guidance on how to get the help. So we got to be there for each other right now in light of everything going on with COVID. Things are tough for a lot of people right now. And so we need to be there for each other and hold out our hands. Maybe don't actually touch hands, but hold our hands out to each other and let people know that we're here. So.
Yeah, absolutely. Thank you again for having me on.
Okay, and thank you to all our listeners and or watchers. I hope you have a great week and I will see you next Monday. Be well.